Answering additional CT scan questions is Heart Center cardiologist Dr. Daniel O'Day. Can a CT scan look at other arteries in the body besides the heart arteries?
We have the ability with our 64-slice CT scanner to image the arteries from the head to the toe. Typically what we would do frequently would be carotid arteries, where there might be an ultrasound test in the office that raised the question of a blockage. Usually this is in a range of 60 to 70% blockage or 50 to 70% blockage. The CT test is used to narrow down exactly how blocked those arteries are. Other arteries we can look at include the arteries of the chest, looking for aneurysms of the aorta, also of the abdomen, looking for abdominal aortic aneurysms, and also of the vessels to the lower extremities, looking for reasons for what we call claudication or pains in your legs when you walk.
Why is a patient given a beta blocker before the CT scan?
We use beta blockers for CT scans in order to slow the heart rate. Let me tell you why. For CT of the heart, we need to have the heart going relatively slowly in order to take pictures of the heart that are good. If the heart's going very quickly, it's moving. If you think about it, the only part of the body that we take pictures of utilizing a CT scan that's moving is the heart. Everything else stands still. If we take a picture of the arteries in your legs or the arteries in your stomach, they're all standing still. But the heart is constantly in motion, 60 to 70 times a minute, every day of your life. So the way the CT scan compensates for that is we take multiple pictures at each time in the cardiac cycle, and then we average those over the course of several cardiac cycles. Because of that, we would like to have your heart rate at a relatively slow, relatively steady rate.
What is the radiation risk from a CT scan?
The radiation risk from a CT scan depends on what part of the body is being scanned and what test is being done. A calcium score, for example, has an extremely low radiation risk. It is roughly equivalent to flying from New York to Los Angeles on an airplane. Multiple studies have been done on flight attendants and pilots and people like that, and even though they take those routes every day, multiple times a week, for multiple years, there is absolutely no increase in cancer risk for people with those jobs. Because of that, we feel that the risk of cancer from a CT scan is relatively low. If you do other parts of the body, the rate of radiation goes up a bit. The radiation for a CTA of the heart, for example, is roughly about a third to a half of that of a nuclear stress test, and about equivalent to an invasive cardiac catheterization. Advances in diagnostic imaging occur on a relatively frequent basis, and the radiation dose for all these tests have been decreasing virtually every year.